Okay, so we're really pleased today to have visiting Julia Fleckman, and Julia is an assistant professor in the Department of Social Behavior and Population Science at the School of Public Health and Tropical Medicine at Tulane. She serves as the Director of Research and Evaluation for the Tulane University Violence Prevention Institute. She's a social epidemiologist, and her research includes evaluation of structural and community level mechanisms for prevention of community and family violence. She has a particular emphasis on community partner research and evaluation, multi-sector collaborations, and community organizational capacity to utilize data in practice. She kind of fits right in here. Just saying. She's currently the PI on several projects funded by NIH, CDC, William T. Grant Foundation, and the Pincus Family Foundation. So we're very pleased to have you here today and can't wait to hear your talk.
Thank you so much. And thank you all so much for having me. I really appreciate it. I'm a little nervous. This is a big turn. I'll stand close to the mic as well. Is this on? Yeah. Okay, great. All right, perfect. As Deborah said, I'm an assistant professor at the Celia Weatherhead School of Public Health. I also serve as the Director for Research and Evaluation at our Violence Prevention Institute. And today I'll be talking a little bit about getting at the roots, the role of public health and community partnered work in preventing violence. So just a brief outline. I will very briefly talk about violence as a public health issue. I think that's an important context and framework for which we really start this. And then I'll talk a little bit about really the two main areas for my scholarship, which are defining structural and social determinants of violence and thinking about community partnered and really community integrated research and evaluation. But before I get into that, I have more people than I could ever list. Nobody does this work alone. And I have incredible mentors, collaborators, community partners, and other funders that I would like to just acknowledge and say that, you know, in public health, we don't do this alone, and there are really too many to name. But I'm so grateful for everyone on this list and many more. And a little bit about my personal and professional history. I want to say that I think this is a really critical moment. I've talked with several of you this morning, and I know we're all thinking it in this space for us to really think about and reclaim public health. You know, I think in many ways I see public health as politics, because politics is really what we as a society decide matter. And we've seen a lot of disruption to our, traditional infrastructures for public health, for our research. And it's just a moment where I really want to highlight that it's important that we stay together. I see a lot of power in the collective. It's really encouraging to me to meet all of you today and really think about how we can come together to be more innovative, to really resist, to really think about things differently. And I don't see violence prevention as any different. I really see it as very integrated and interconnected with a variety of different areas of public health, and really understanding and addressing the causes and consequences of violence is something that's, it's a critical mission for me for what matters. And even more so, community-centered work really matters. And I think that's more important than ever. So I'll be talking a little bit about that as I move through the course of this presentation. I'll also really talk about, that's really where I started. I worked in community development settings for almost 10 years before I went back to school. And so I really come at this work with that lens. I do very applied work. Yes, I was trained as a social epidemiologist. Yes, I was trained in research and evaluation. I have really incredible mentors and colleagues to thank for that. But it's definitely what got me into this field to begin with. So we can dive right in. And what I want to tie this to, and violence as a public health issue, is, as many of you know, the Division of Violence Prevention at the CDC was categorically dismantled 2 weeks ago. I will highlight that. Fortunately, they still have a couple of surveillance folks on the team, but I think it's more important than ever that we highlight the need for data surveillance and really understanding the scope and impacts of all sorts of morbidities and mortalities that we could think about in the public health realm. And Whiskers, which I'm sure all of you have used in different capacities in your work, is one such data reporting system that I think is really useful in understanding that. And something that is not always well known is that violence is a leading cause of mortality. It is in the top 10 leading causes of death for anyone between the ages of 1 and 54. And I'll really just highlight that. I'm not going to be able to get this thing to work, so I'm not going to use the pointer, but between the ages of 1 and 9, it's the third leading cause of death, homicide. I want you to just sit with that for a minute. It's, whenever I really see this, it's a really stark reminder, and that's just really one way that we've captured mortality related to violence, homicide. Not only is it a leading cause of death, it's also a leading cause of injury. So again, kind of highlighting for you all, these are the 10 leading causes of non-fatal emergency department visits. Assault-related injuries are the 8th leading cause for ED visits for all ages. So it's a big problem, and we really need to think about and frame that differently, and really think about it, how we go about preventing and addressing it. We're newer in this realm with public health. It wasn't until really the 1980s that we defined violence as a public health issue. And I'll just really briefly highlight in that, beyond just morbidity and mortality, there are a number of other impacts that we should consider. Violence leads to all sorts of social and community disruptions. It leads to a host of mental and behavioral and physical health outcomes that we could look at. It diminishes quality of life. And that doesn't happen just on the individual level, it happens on the community level. And we see disproportionate impacts on particularly marginalized populations and communities where we really need to consider more of our health equity framework. So I'll just really highlight that, I think public health has a unique and really interdisciplinary work, but public health framing has a unique contribution to make around preventing and addressing violence. And, when I think about public health, I think we have a really unique opportunity to use science to understand and explain complex etiologies. We have an opportunity to really think about equity and what that means. We can see this beyond maybe the more traditional clinical or individual level interventions, which have historically really where we've invested our time and energy to think more about population, community, and even neighborhood level impacts. And we can think about prevention in a number of different ways, right? We can think about it from a primary prevention angle and how we prevent violence from occurring. We can think about that whole spectrum and how they might fit together to really address this cohesively and comprehensively. And not only that, what is something that's really exciting to me about the work many of you are doing is we can really think about ways to measure impact that are beyond our traditional metrics. And not just impact, but implementation and sustainability. WashU is a powerhouse in that realm, so I don't need to tell you all that. But I think it's really, really critical that we think about sustainability in this realm too. So I'll dig in now and slow down probably a little bit, as I always talk fast when I'm nervous, and think about this first area of scholarship that has been one major area of focus for me, which is really examining and thinking about social and structural determinants of violence. And I will say here, I'm talking to a room full of public health professionals. I probably don't need to define what social and structural determinants are, but I think it's a nice framework to just have a collective understanding, given that we might all have slight variations in how we think about this. But when I think about structural determinants, I really think about overarching societal systems and mechanisms that shape health outcomes. In my area, that might be violence. I think many health outcomes are interconnected, and we'll talk about that a bit too. But that's the framework, that I'm really taking for this. Social determinants are really thinking more critically about social, economic, and environmental conditions that shape people's lives and health. And I think discovering and addressing social and structural factors that may influence community and family violence is critical for the development, implementation, and sustainability of effective prevention strategies. So we'll talk a little bit about those, but I want to highlight here really quickly that I didn't do much of this work in isolation. Many of the questions, and I'm going to come back to this later in my second area of scholarship, but many of the questions that I asked as a part of this were driven by community partnerships and cross-sector partnerships. I really believe that there's a need to integrate more complex ideologic research with what communities are experiencing, what they see as the solutions, they see as the primary drivers, and how we might give a lens to, really thinking about that from a research perspective. So a lot of the questions asked here were driven in partnership, and I'll come back to that in a little bit. But I want to also highlight that this might look like very disparate types of work. You're going to see primary prevention for child abuse up here, intimate partner violence and child maltreatment as part of family violence, early childhood exposure to violence, firearm homicide mortality, even mass shooting events. I think a lot of that might seem like very different topics to you all. And what I want to highlight more concretely is that I define and see violence as very interconnected. In fact, they're oftentimes driven by the same social and structural conditions and processes. They're oftentimes co-occurring. And I think a challenge that we've really experienced in this space, particularly on the research side of things, is that we oftentimes tease out one form of violence, and we focus just on that. And we measure impact from a particular intervention just on that one outcome. And what throughout the course of my work over the past really 15 years, oftentimes I've seen is that they're very interconnected. For a great example is in the firearm violence space. Firearm violence touches children. It very much happens in intimate relationships. It happens between other family members. Yes, there are community dynamics there that we need to consider and that drive it, but it touches all of those things. And unless we think about them together, we're never going to really creatively find those determinants or how to drive change. So I think that's an important part of it. And one takeaway, if you're going to take away anything here, that I hope you walk away with. So I've done quite a bit of work in the realm of understanding inequities and exposure to violence, particularly when it comes to young people. I've oftentimes in our group, we've looked quite a bit at how inequities are compounded. And I'm going to talk about one particular project that we're working on now and how that's been integrated into some of our community partnered work, looking at sort of long-term and more shorter-term markers of structural racism. We've even looked at legislative support in action around particular types of policy change. We've looked at economic security, food insecurity, housing security, a number of other indicators there, and even neighborhood physical and social conditions and processes and how that might play. Things like the built environment and how that might be influencing what's going on the family level, on the individual level, but also on the community level. So one recent example that I'd like to highlight, given that this, again, was really connected to some questions we were asking as part of a larger coalition that I'll talk about a little bit later, and really driving sort of a multi-level, systems-wide rollout of several interventions that are happening in New Orleans. A lot of our community partners were really interested in understanding how structural violence and structural racism in particular might impact young people, and in particular, impact firearm violence in our city. So this is a work that's just about to be published, and I'm pretty excited to see that along with our community partners as co-authors, which is really a neat process. And I'll only say this very, very quickly as a quick background. I highlighted the impact on morbidities and mortalities, but it's particularly significant amongst young people. I'm thinking about, you saw the 1 to 9-year-olds, but 15 to 24-year-olds also are significantly impacted by firearm violence. And that's especially true for Black young people. We've seen decades of chronic disinvestment in neighborhoods. We've seen a lot, disinvestment in young people and who they are. And so, a lot of our partners that work directly providing youth services and doing community violence interventions, they see this on the day-to-day. They see how that works in the immediate term. They also have seen the long-term impacts of that. And I would say, many of our national partners see it too, but for us to look at this empirically was really important. I could talk a bit, but I won't do it too much right now. And the challenges with defining and measuring structural racism and what that means. There's a lot of challenges, and I'm happy to chat with any of you that are interested in that. I'd be particularly interested if other folks are working in this space in considering new and innovative ways, because this is not without its limitations. But we know that there's a connection to violence. We just don't know for this particular population how that might manifest, particularly on a neighborhood level. So we went ahead and did a series of models, which I won't get too in the weeds about the methodologies here, but looking longitudinally at the neighborhood level within New Orleans, how two particular markers of structural racism were potentially influencing youth firearm homicide. And we used one that's been used quite a bit in this space, both the social epi space, I should say, which is the index of concentration at the extremes, developed by Nancy Krieger at Harvard. And it's really a marker for racial, economic, residential segregation or polarization. And what do I mean by that? Well, I mean, when we're considering both racial segregation, but economic segregation, how we can measure the most privileged neighborhoods, which are the most concentrated white, wealthy neighborhoods, compared to what we might consider the least privileged neighborhoods, which are the neighborhoods of color, where the economic disinvestment is very obvious, both on the family level and really on the neighborhood level. That was one marker or measure we used. We also looked at, given the interest in really community violence intervention work, historically that's been done by police. With lots of challenges. There's been a little bit of research in that more proactive policing might lead to reductions in violent crime, but frankly, after that, it's a very mixed bag. And we do have pretty substantial evidence to show over-policing or overexposure to police violence, chronic exposure, might actually increase violence, particularly amongst young people who start to see police as really adversaries, right? And what that does for psychological stress, what that does for a number of other manifestations that we can get into here. But we really wanted to look at that disparate exposure and use it as another potential marker for structural racism. And so that helped us, through this kind of co-design process of defining these series of research questions, we really ultimately wanted to look at this study and look at structural racism's potential impacts on violent injury, specific to youth on the neighborhood level, and explore that connection. So as I mentioned, it was a longitudinal ecological study. We looked at that relationship. We used these two measures. I'm going to figure this out. There we go. With the ICE measure and then some police data. And I want to give a shout out to some of our data partners here too. ICE is taken from the census data from the ACS survey, but the police data, we have publicly available data. I also do have, law enforcement partners in the data work here. They've been very passionate about improving data systems so that we can do more prevention work because they don't want to be reactive. That's actually outside of what they see the realm of their work. And, New Orleans and many other cities within the US and internationally have a sordid history with law enforcement, but they see that. And so they've actually been very, very supportive of some of this work, which has been really interesting to see. We looked at those two markers. And then as part of a larger project where we developed it's still sort of in process, a database of all firearm-related violence in New Orleans. We're actually building that out statewide. And I'm working with partners nationally to think about that in other places where we've merged law enforcement data, level 1 trauma center data, as well as some other kind of more non-traditional sources. There's a publicly available data source called the Gun Violence Archive, which is nationally available and actually fairly robust. Really cool nonprofit for those of you that have not checked it out. And they have about 3 staff people that do all of that work. And they collect firearm incident data on a national level from media sources, law enforcement, public records, a few other sources as well. And that really allowed us to fill in some of the gaps that we were finding, because not everything is going to hit the hospital. Not everything is going to hit law enforcement agencies. We also worked with the coroner's office and the Louisiana Department of Health And that really allowed us to, I think, have a more accurate picture. We've developed that for fatal firearm incidents, and we're now close to getting there for non-fatals, but that is a more complicated process. I'm happy to chat. Kristen, I know you've dealt with this and a few others as well. And we use those data as sort of to help measure our outcomes, which was really mortality related to firearm violence for youth, and that was assault related. So what did we find here? I think that's the bigger piece that I want to highlight. What we found was that we looked at this a couple of different ways. We wanted to look at shorter term trends, looking at annual means or annual rates over time and how that impacted firearm violence, but we also wanted to look at long-term trends. So we took means across years to look at this and ran a series of negative binomial models for those that are really interested in methods. And what we found, I think most critically, is that the longer term patterns seem to have more influence, seemingly had more influence on those firearm homicides. So we saw for the index of concentration at the extremes, which is again that measure of sort of racial economic polarization, there were significant positive, inverse relationships, because it actually goes the other way, where less privileged groups are negative numbers. But that, that seemingly less privileged areas were experiencing higher numbers of youth firearm homicide. Both when we looked at just the annual numbers, and when the long-term trends came into play, when we looked at those mean scores, it was an even more highly significant, larger effect, which was important. For the police stop and search encounters, I'm going to talk about the challenges with some of this too, because these are imperfect data in every sense of the word. The short-term variations were not significant, but when we looked at the longer-term trends, there was a small effect. And it was sort of in the direction where we expected. So in the very privileged areas, where there was policing or stop and search encounters, higher stop and search encounters, it seemingly had a very small effect of reducing youth firearm homicide for white youth. And it was the opposite for the least privileged neighborhoods for Black youth. There were very small effect sizes. I think there was challenges, and something I want to highlight too is that next what we want to do is we're working with the police department to get access to better data beyond the public data we had access to, because these were just stop and search encounters. We definitely did some sensitivity testing, looking at stop and searches where those might result in something like an arrest or summons that might be for more particularly violent or severe offenses. That didn't change the results. But something that I think we need to really consider is how we think about inequities in policing and over policing. We couldn't narrow it down to think about stop and frisk, for example, or even number of officers involved in an incident, what the level of force was that was used, right? Those are things that I think are kind of critical questions. And so now, as a follow-up to this analysis, we're actually working with them to get more internal data to kind of look at and measure that as a potential exposure. Just really quickly, I think this just highlights the need to think about interventions, from like a systems lens, from a multi-level lens. And we need to think about, this is the way our partners have thought about it, investment with programming services that are integrated into particular communities that are most impacted. And so that's kind of how they've been using it, and I think a critical piece of this work. So overall conclusions, I'll just say, is that I think neighborhoods matter. That's a lot of what's driven my work. Hopefully this is added to a growing literature on that broader psychosocial environment and what that does for health. But, even if we have larger, policy interventions of that, things of that nature, they still matter on the local level. So I really think about that a lot and how that is contextualized to my work. So given all of that, drag at the time, I'm going to hopefully fairly robustly talk about some of my community partnered research and evaluation. I've mentioned it a couple of times, but I want to kind of backtrack and talk about this as sort of a larger area of scholarship. And I will say for you here is like, you're not going to see this work published right now, most of it. Why is that? Well, it's taken me almost 10 years to build relationships and to really think about an integrated approach and a cross-sector approach to how we do this work. And I'm just one person out of many. I always want to highlight that. And so we're just at the stage where this has become a really interesting and innovative, I think, area for thinking about public health and research, and are getting research grants to really further the work we do together. And I see that, I'll say that too, this is part of a larger national network of folks doing work in the space. And we've been working collaboratively to think about how we do that in a variety of different settings, because I think it applies to St. Louis, to many of the other places which people live and work. So I'll talk a little bit about our Violence Prevention Coalition. This really started, 2018-ish, but I think more robustly towards the end of 2020, for maybe not so great reasons. As many other places in the country, we experienced a surge in firearm violence and other forms of violence. That happened across the US, internationally. We've seen that in a number of contexts. I think part of the challenge with this work is that usually it comes out in a moment of crisis, right? But it's also a moment of opportunity. But I think where that can be really challenging is people want to have the quick fixes. Everyone does, myself included. You want to make the problem better, right? But if you don't do things very intentionally, the sustainability of it can really be diminished, right? So what I think was really interesting about this particular coalition is that it actually came out of a really interesting dismantling of some of the violence prevention work that had happened citywide. And I could talk about those reasons, but I think I'll leave it at that. And that many community organizations lost funding, things were shifted, programs that they felt like had been meaningful and had really significant impact, but maybe hadn't demonstrated those impacts with data, were pretty much dismantled. That was a really tough moment for the city, especially during COVID, when some of those more traditional approaches in more community settings and hospital settings, we had a tough time figuring that out. But what I think happened was people realized we needed to do it differently. So I began work with the new Office of Violence Prevention within our health department, who decided to convene a local coalition of stakeholders across different sectors to really think about this. And my work as really the research partner was really informing how that coalition was built. Like, what does the evidence say around coalition building and around coalition forming? And B, what are some of the prevention and intervention strategies and approaches that we see as the most effective? Well, that's challenging because this area has been historically underinvested in. And so I would probably call those emerging strategies still now, but we'll talk a little bit about that. And so I think we had this really interesting opportunity to bring people together that have not typically been in that space together. We went through a strategic visioning process. We thought about multi-level citywide strategies. I really pushed for having people in the room that could really speak to the different types of stakeholders that should be there. I tried my best to do that, as did many other folks. And I think over time, through lots of trial and error, we've seemingly gotten there in some capacity. We have people from a number of different community advocacy groups. We have youth representatives. We have people with really significant lived experience that have not only had experiences with violence, but have done intervention work. We have local government, we have people from the healthcare sector and the mental health care sector. We have the school district involved. I could name a zillion different people that are in the room. It's hard when you have that many people in the room. So how does that work, right? That's something over time we've really teased out and figured out. And I think I'll just focus on my role really being, again, kind of helping inform like what we can distill from the evidence base and what other places are doing. that may or may not work here? What are those big domains and areas? And then from a data systems perspective, so some of the work we've been doing just as one piece is around building this firearm database, how we can really think about integrate data differently to look at implementation and to also look at impact. So that's been a number of years in the making, and now we're at this really interesting and important place where many of this has been rolled out. These are some of the prevention approaches that we identified as part of that work. I could go into more detail, but just to some of the big areas, thinking about multi-level correlates. So again, some of those more social and structural determinants, and really need to integrate those into the models we're doing. Thinking about how we're sensitizing and working within systems that touch, in particular, young people and people that have been most impacted by violence, that frankly have not done a great job of figuring out how we stop that cycle. In fact, have maybe even been more detrimental in nature. Other forms of interventions, and a couple of which I'll talk about in just a minute. And I think really critically, this more cross-sector and collaborative partnership and coordinated approach, continuous coordination, not just a one-time coalition that you build to do this and then you disband. How do we create investment in doing this in the long term? So that's kind of where we moved. And I'll highlight a couple of examples of the type of evaluation projects that have kind of spun out of that larger coalition building. Both of which are in process, and frankly, we'll see what happens with the federal funding. So this larger ecosystem evaluation, I was funded along with a couple of other colleagues by the NIJ and CDC to look at an integrated approach between two emerging strategies, I would say, that there's some good evidence out there for them, but how and why they function and the impacts they might make are less known. And what's really emerged more recently is the need to integrate the two. So what are called community violence interventions? Those have really, we've seen a lot of investment in the last 3 years in these community violence interventions and evaluations. Community violence interventions, there's a number of different models that look at this. The most well-known that you probably have heard of in some capacity, but has its limitations, which is why we have redefined those, is cure violence, or what was formerly known as ceasefire, where you have really credible messengers that are doing work to build relationships in community, think about how they disrupt and mediate potentially violent conflicts. But I think even more critically, how we kind of address some of those larger social determinants, what types of programs they're partnering with, services they're offering, where they're focusing, who they're focusing with. All of that's less well understood. And frankly, needs to be adapted to local context for lots of reasons. And then another strategy, which we're lucky enough to have a couple of people in the room who do this work too, is our hospital violence intervention programs. When someone comes in that's experienced a violence-related injury, the likelihood of them getting injured again is quite high. There's been good research to demonstrate that. So how do we kind of disrupt and mitigate that potential reoccurrence? And there are ripple effects there too. It's a really traumatic event for people. And I think that it's a critical moment when we might engage and think about structures for support and even potential for retaliation, which we see quite a bit where we are. And where, at least preliminarily, we've seen some potential success is when those two approaches are sort of integrated, given that they might be interacting with similar with individuals, or even beyond that. There's sort of a spectrum there. And so what we designed this project to really do are kind of two things. The larger passion piece for me, which is how we think about and define that multi-sector coordination and engagement across all of these partners, what that looks like, how we think about implementation, barriers and successes, how we think about sustainability, how we build a model for this, has been one really big area there. And one place we started was just sitting together in a series of interviews and other things that we're doing now to really think about what are the key process pieces and what are the key outcomes that we need to be looking at. Historically, these interventions have looked at either reoccurrence of injury or likelihood for experiencing firearm violence, either a fatal or non-fatal shooting. Well, it's really hard to demonstrate the potential for that. And frankly, I see these interventions as needed for a host of health outcomes. I think many of you could hear this and think about your own work. And frankly, it's about people's well-being. So we need to consider that more broadly. And it's of real importance to the people doing this work. So we've worked over the past several months, years, to really define what that looks like, and are now finally at a place where we're finalizing that and thinking about the types of data that we're going to collect. And it's not just surveys with participants. We're doing really cool narrative work at community events and with stakeholders. We're thinking about in-depth observations and interviews with people that have been really embedded in this work for some time. They've been involved in the research process as well. And I'm hopeful to see this as part of, again, like a national network of folks doing this that we can really plug into. And then very, very quickly, a couple of last slides as I wrap up in my last 2 minutes. The second piece I'll quickly highlight, which is brand new, just funded work, is schools really came up a lot in this space, and school engagement or disengagement. And frankly, the number of students that have been impacted by gun violence it's pretty unreal. And I don't think that's unique to New Orleans. I think that's a national problem. And there's different types of firearm violence. We could talk about school shootings. We could talk about community exposure. We could talk about family. But something that we see critically is that a pivotal moment is when kids start to maybe demonstrate some behavioral issues in school. And they're generally, there's pretty punitive approaches to dealing with that. Trauma-informed school systems and that type of work has done a nice job of trying to think about this differently. But really, frankly, too many kids end up being suspended and expelled, which can really increase risk for violence involvement. So this intervention, is small bits of work looking at restorative models and restorative approaches for school safety. We're trying to expand that and work with people who are part of our community violence intervention. And an organization that really has done this work for a long time, has seen the impact. How do I highlight that and help them show that? To test a restorative model to divert kids away from those things. So when there's sort of those early warning signs, how do we get schools on board with this? And it's really an implementation science study and a small outcomes evaluation, but the goals are really to build this out. More large-scale testing and adaptation of both the coordination and intervention strategies, and then building that model for cross-sector, multi-level systems change and community change. And these are some of the pieces that we're really thinking about in that domain, cross-sector collaboration and coordination, community integration, data systems, what we're using, what we're not, how those systems speak to each other or don't. And then I think most critically, sustainability. It's an area we need to do better on in public health. And I will be the first to say that as not having done that well in the past. And we can demonstrate certain types of impact, but if we don't really think about the long-term solutions and how we might build a model that other people can use, and there's investment for that type of sustained use, I think we're missing out on a real opportunity for change. So I will leave it there and take any questions. They'll ask first, always the awkward moment. Yes. Thank you.
I'm struck by the fact that since at least the early 1990s, if you look at places where gun violence, gun homicide rates are the highest per capita, this town, St. Louis, and your town, New Orleans,
Are always in the top
they're
10.
always in the top 3.
Yeah.
I mean, maybe give or take. And there are always efforts. People are always trying things, but we stay there and you stay there. Are there examples that buck that trend? Are there cities that were in the top 5 decades ago and now they're not? And are there models that work? Because I guess I have a sense of frustration and
I have so many answers to that question.
Yeah.
I have a lot of answers to that question. I want to highlight that there was no federal investment for gun violence prevention or research, programmatically or research-wise, until 2020. 2020. I was one of the first, the CDC grant was one of the first firearm grants to go out. So and despite that, there are incredible activists doing programs that matter. There are incredible researchers that have done this piece without the funding, really. But I think that's hard when you don't have investment. That's one piece of my answer. The second piece is, I think we could say that about a few areas of public health, and you see a lot of those same conditions in these same cities, right? And part of that is what I was speaking about there. In my opinion, the lack of kind of planning to think about sustainability, the lack of bringing partners together in a coordinated, cohesive way. That's not just we're going to build this coalition and build a strategic plan. Let's do this. Let's think about this in the long term. And then you might have a change in administration. You might have people leave a job. Those tend to disappear. And the people that are on the ground doing the work and passionate about it, they don't have the support or the funding or the knowledge on how to get the funding, to keep doing it. There are a couple of cities, I think, more recently that have done this well, probably not in the realm that you're talking about, but I also think it speaks to the structural and social determinants I'm talking about too. Cities with, maybe less disparities in certain, structural conditions, where you've seen more investment, that might be, you might see those, more investment in those programs. Yeah, those would be kind of my big answers to you. Yeah.
Thank you.
Yeah.
Thank you for your talk.
Yeah.
I have a question about going back to one of your earlier slides where you showed some data on
Yeah.
the risk factors and the causes of injury and death. And I'm going to talk about the injury for a second.
Sure.
Because you talked a lot about this primary prevention in schools and communities, which I think sounds fantastic. Has anyone looked at the secondary prevention coming from the ED or trauma surgery or areas such as that? And do those work?
Yeah, I think those are those hospital-based violence intervention programs that I mentioned. Those, I still think we have a good ways to go in really evaluating the full scope and the full impact of that. I think that's for a number of reasons. Actually, I'm gonna keep calling out Kristen in the front because she's doing this right now. There's challenges with those data. Think about like the hospital data you're getting in particular. And so one good example is like, if someone comes in with a firearm related injury, the classifications for if it's assault related, self-inflicted or unintentional, it's generally pretty poor is what I would tell you. So we can't even really, and those are maybe different mechanisms for prevention and intervention in those spaces. I think that's a really huge area in the field right now. And so one of the things we're testing is that integration with a community violence intervention and people that have come in as with a more secondary prevention piece, how that might work. But as I mentioned, I think it's more of I would say we're close, but it's still maybe an emerging strategy. That's been part of this big federal investment is around evaluation of those types of programs. And the other place where I would say that matters too, beyond just people that have experienced some type of violence related injury, are with firearm safety. There's been a bit more in that space. So for example, in maybe in like pediatric settings or children's hospitals, or even with adults, really engaging with people around firearm safety as a mechanism for potential for different, forms of firearm related injuries. There's been some really great emerging evidence in that space too. Yeah.
So thanks for being here. I'm curious, and I probably don't need much setup for this question because you alluded to it, but I'd like to hear, like, let's say 5 years out, the public health surveillance for gun violence, and talk about the dream and talk about the reality, if you would.
Oh, okay. I'm going to be as diplomatic as possible. So the dream is, I think there's critical gaps in how we measure firearm violence now, even though it's really important. As I mentioned, the two places we can really demonstrate that are looking at homicides, right? And firearm related homicides maybe, but those are hard to classify. It's sometimes easier with death records, but maybe not. Hospital data, the non-fatal side of it is where we've really had a harder time. Because people might not be going into a level 1 trauma center. People might not be interacting with law enforcement. So, the surveillance piece is tricky. Where I see really innovative approaches is when we integrate data systems. There's even some cool machine learning pieces that are coming into this too. Community partners that are interacting with individuals that maybe have experienced firearm violence and how they think about how we tap them into larger surveillance. And I think with them in particular, with health departments, they've done a great job in some ways of thinking about surveillance systems for all sorts of other health outcomes. Why can't we include them in this? So I think there's real opportunity to build up data systems to have a more accurate picture of this. The Gun Violence Archive, I would say, is like the only national source that looks at that probably captures the non-fatal shooting piece in a way that maybe the emergency department and hospital data doesn't. But the classification of the causes and the circumstances are less well defined given where they're pulling those data from. So my dream would be, how do we put this all together? I think there's a real opportunity to do that. I am not an expert in machine learning or anything of that realm, so I would love to talk to more people about that. But I've certainly on a more local context kind of thought about those questions and what some ways we might be thinking about that differently. The reality, I don't know. I am hopeful that we'll still, with more, with data sources that won't be impacted, like Gun Violence Archives, that will still be able to do some surveillance here, and perhaps in more local settings. I'm not sure what will happen, and I just hope that we can see this as a real investment, for public health. All of these causes of morbidity and mortality are critical. Yeah, I wish I had a better answer for you there.
Any foundations like Bloomberg might step up?
That's an interesting question.
Surveillance?
And we've seen that, like the county health ranking work that Robert Wood Johnson funded, but that's, there might be opportunities for something like that. Definitely, that's a great question. Yeah. Oh, yeah. Okay.
Thanks, that's great talk. So early on, you talked about, and Emily throughout the issues of structural issues and interventions. And the structural interventions are going to involve on some level policy.
Yep.
And so you talked also about the coalitions.
Yeah.
What kind of role do policymakers play in these coalitions?
That's a great question.
And how do you see moving forward? I mean, I don't know, I'm into dreams, Ross, but I'll say 5 years forward. What kind of role do you see them playing, and how would you get them involved? Because a lot of these changes aren't going to happen without them.
100%. So because this has been situated in New Orleans, we've had several city council members, a couple of really one, but maybe two that sit on this coalition and have been really intimately involved. But I think it's going to take state leaders. I think it's going to have to be a national conversation too. And that's sort of a newer area for me, quite honestly. And thinking about the advocacy and policy piece, I just submitted an application to really kind of think about that, and the advocacy piece for in general, and how we use this coalition as a potential way to think about advocacy for policy work, and what that might look like from maybe more of an implementation perspective. And in 5 or 10 years, I'd like to see that piece built out, where we have real kind of tangible asks. We can say what interventions, are effective or not, how they're making meaningful change, how we've involved local policymakers in that process. We've seen some really interesting and important investment from the city in these programs as a result of some of this coalition building and this work. So they just announced an additional $5 million in investment for this ecosystem, the programmatic piece, not my piece, which I think is really valuable. And how do we kind of think about and scale that up in more sustained areas for support and infrastructure? Even things like, we've talked a bit about this, and other states have been very successful in Medicaid reimbursement for hospital-based violence interventions. That's something that's happening. And actually we have people interested in that space. But I think the structural conditions in the neighborhood really matter too. So something we've really talked a lot about are like economic security, housing security, and how the types of policies we really need to demonstrate matter here and how we communicate and include people in those messages.
It seems like the communication would be really important.
It is, and it's not my area, so I would be looking to Matt and other people
Right, well,
to really help me with that.
I mean, I should be able to do that. It's
Yeah.
pretty good.
Yeah. Yeah, I think it's a really important question to ask, and I think we'll be very critical for thinking about the sustainability piece in particular.
Any other questions?
Yeah.
One for closing. So you've talked a lot about the challenges, the workarounds. What in this work is giving you hope, and where do you see the opportunity in the next few years?
I love that question. What has given me hope is more investment. Frankly, we've seen a tremendous amount of investment and more sustained investment. I think we're seeing that despite some of our challenges nationally, on a national level we've never seen before, and more people doing work in the space. Students give me so much hope because they are passionate about this. They are unwilling to compromise in a certain way. They will do what it takes. Those things really give me joy and give me hope. And then seeing people come together in a way that I didn't expect as part of this coalition, partners I didn't expect in the space. I think that's something that I really hope to see continue. It's across political domains, it's across like life experience, it's across, background, it's all of these things that people really do care. There's obviously other challenges, but I think that's a really important piece of it. And I hope to see that grow. I think we're going to need more of that. I do. Yeah. Great question.
Thank you very much.
Thank you so much.